So real quick, I'll do the quick way of remembering it, and then I'll answer that more directly. Okay, real quick, if you're not single, pretend you're single for a moment. You see the most attractive guy that you've ever seen in your life, okay? Do you want him to be single, or do you want him to be married already to somebody else? You want him to be single. You want him to be single. And that is very excitatory when he is single. So the ones are excitatory. But 2, he's already paired up with someone, that is inhibitory. That is a no-go. You are not allowed near that relationship, okay? So excitatory, inhibitory, odds and evens. They say odds and evens ruled because technically there are more, like there's a beta 3 or there's muscarinic 1, 2, 3, 4, and 5, but they're not having you memorize those. So this rule works as well as if you just remember that it continues, meaning that these ones were excitatory, inhibitory, which means if there were more, there would be excitatory, but you won't have to learn them, so yeah. But yeah. Okay. Excitatory versus inhibitory. A lot of the times these are, so what are these on? What are the effector organs that you've drawn here?
What are they on?
Yeah, what are they skeletal muscle?
Well, we talked about the different organs, I guess.
Okay, so they're going to be organs,
Or
glands,
glands, eyes.
smooth and cardiac muscle,
Yeah.
but not skeletal muscle because that's what we have control over. So anything in the autonomic nervous system. So if it's on a smooth or cardiac muscle, for example, if it's excitatory, that's going to have contraction. If it's inhibitory, it's going to relax it.
Okay, so excitatory is contraction.
So if you have a beta 1 on your heart, right?
Right.
So when you have your adrenaline pumping, you have norepinephrine on it, okay? That's going to cause it to contract, okay? Because epinephrine or adrenaline in your system, your heart's going to be beating, right?
Mm-hmm.
But for example, we'll pretend we're in a world of chaos. We have beta 2 receptors on our hearts. Just beta 2, nothing else. Just beta 2. What's going to happen when you're chased by a bear? It would slow your heart rate down.
Mm-hmm.
Okay? So this was the pretend world. Just clarifying. If we only had beta 2, so inhibitory receptors on our hearts, because they're adrenergic, whenever we had adrenaline pumping through our body, it would inhibit. So if beta 2 was on our heart, the adrenaline would slow down our heart. Okay? Luckily that's not the case, and they're beta 1, so they excite. That means we can run faster, so we can hopefully get away from the bear. Playing dead could work, whatever. But yeah. Okay. Does that make sense?
Yeah.
Okay. You've talked about agonists and antagonists. What are agonists versus antagonists?
Antagonists block.
Mm-hmm.
Agonists
do the opposite.
do the opposite. Just do they just
help
excite a little bit more?
For example, if I put acetylcholine on a muscarinic receptor, that would be an agonist. It activates the muscarinic receptor. So norepinephrine on a beta 1 is an agonist. Norepinephrine on a beta 2 is an agonist. It's letting beta 1 or beta 2 do its job. Okay? Whereas antagonist is like if someone is antagonizing you, it's stopping you from doing your work. Okay? Like if you're trying to do your homework and your roommate's antagonizing you, then they are stopping you from doing your work. And so you think you might want to antagonize their heartbeat. Don't do that. That's bad. Okay. So you have beta 2, so on your bronchioles, you have beta 2 receptors. Okay? So if I use something that was a beta 2 antagonist, what would that do to your bronchioles? Think it through. For you guys, I'll help you through it a little more. You try to figure it out yourself, okay? So ignore me for a second. So beta 2, what does that do? Inhibit. So on my bronchioles, it's inhibiting. It's probably smooth muscle, right?
Yeah.
Okay. So it's inhibiting the smooth muscle. So is that going to cause dilation or constriction?
Constriction.
Something that inhibits. So it inhibits the muscle that'll dilate, right?
Dilate. Well, I didn't know, our muscles normally supposed to not dilate.
So exciting something would be like exciting a muscle.
Mm-hmm.
You know what I mean? Which one do you think is excited? When I'm flexing or when I'm
Yeah,
relaxed?
gotcha.
Excited, not excited. Excited, not excited. So excited,
Mhm.
not excited.
Okay.
So it would normally cause bronchial dilation. But
Yeah.
what happens for a beta-2 antagonist on the bronchioles? Will it cause dilation or constriction?
Hold on, I was listening to you guys and
Oh,
not
you're totally fine. So beta-2 antagonist.
Beta 2, so it's gonna block beta 2. Beta 2 is what allows it to, hold on, I can't think this through.
Just do it one step at a time.
One step at a
This is
time.
what I do. This is what I do.
Do you draw it out? Because I feel like I'm gonna sit there like
You can,
flexing.
and if you need to draw it out, do it. Just think of the receptor first.
Okay.
Okay? Beta 2 on the bronchioles. What does beta 2 normally do? Would it cause them to
Relaxes.
constrict or dilate?
Relax.
Relax. So dilate.
So dilate.
Okay?
Oh, so if it's blocking that, is it gonna constrict it?
So it'll constrict it.
Oh,
So a beta 2
okay.
antagonist would cause bronchial constriction.
Mhm.
Does that make sense?
Yes.
Okay, how about an alpha 1 agonist? You have alpha 1 on your arterioles or the little arteries, if you will.
Mhm.
Okay? So is that going to constrict them or dilate them? Alpha 1 agonist. Constrict. Does that make sense? Why?
Because it was relaxed.
So alpha 1 wants to constrict it, right?
Yeah. And an
Agonist allows that to happen, so it constricts it. So that's going to be like near your skin and all those things, constriction. It diverts blood because your adrenaline's going, diverts blood to the heart and skeletal muscle. So it'll actually be probably beta 2 or maybe alpha 2, I think it's beta 2, on your on the arteries and whatnot that are by your heart and your skeletal muscles. Because you want blood there so you can run faster, get away from a bear, or your roommate, or that crazy boy that was stalking you, you know. But yeah, okay? Does that make sense?
Yeah.
Okay, we have less than 10 minutes left.
What's muscarinic? Sorry.
Nope, you're totally fine. Muscarinic can be excitatory or inhibitory. Everything that, from what I understand, that they'll have you memorize is all going to be excitatory. Okay?
Mm-hmm.
So it'll be excitatory. It's only going to be found in the parasympathetic on the effector. It's a G protein,
Mm-hmm.
except for one exception. What is that exception?
One exception.
One exception, muscarinic, that's found in the sympathetic system.
I just read this over too.
I'm quizzing you hard.
You are. And I don't even know where the answer is in here.
Sweat glands.
Yep. Right here.
What kind of sweat glands though? Localized or generalized?
Generalize.
Generalized. The generalized sweat glands are muscarinic receptors. So it's still in the sympathetic system. It's just that the postganglionic neuron secretes acetylcholine onto muscarinic receptors for that one.
And that's the only exception?
That's the only exception.
That we talked about.
Yeah, the localized sweating is is adrenergic receptors. Okay, that's going to be the palms of your hands, your axillary areas, and the pads of your feet. So that happens with adrenergic, but muscarinic for generalized sweating. Still in the sympathetic system,
Right.
but it's muscarinic.
Are cholergenic and adrenergic both in sympathetic and parasympathetic? You find them
So
under
you'll.
there?
I typically don't try to put on general rules on them,
Mhm.
but because you're going to find cholinergic in both, between the neurons, they're cholinergic.
Yeah.
You know,
Mhm.
but adrenergic you don't ever find in parasympathetic.
Okay.
That would imply when adrenaline's released that you have a parasympathetic response.
Mhm. That makes sense.
Bear.
Mhm.
But yeah. It's more bear. Oh, yeah.
Mhm.
Okay. Okay.
So-
Amy,
Draw it out, basically, like when I get into the test.
sure.
Cause
Whatever works for you.
I think I'm gonna do that.
Yeah. Draw it out. But what I do is I think about because I don't know if they'll give you tell you there's this type of receptor on this. I don't think they'll do that. I think you have to know that.
Right.
So you have to first be like, there's this type of receptor on these organs. Okay, so I know that. Okay. Then you think about the receptor. It's a beta 1 that wants to activate. It's an antagonist. Okay, so that's going to stop it from doing that.
Mm-hmm.
You know what I mean? So I think of the receptor, then I think of agonist or antagonist.
Okay.
Okay?
Makes sense.